Holly Cotton here, and you guys know that I am all about education, inspiring, spreading wealth of knowledge to all of my listeners and viewers. So, anytime I get to educate you guys and share something that's kind of unique that you may hear about it, but I want to get the detailed information so we can actually utilize that information, I am all on board. So, today I'm super excited. I have Dr. Joy Kong, and Dr. Kong is a triple board certified anti aging physician and stem cell specialist, renowned for her expertise in stem cell therapy and commitment to educating both physicians and the public. She was also the Stem Cell Doctor of the Year in 2019 and the Stem Cell Doctor of the Decade in 2021. So if anyone knows about stem cell, it's going to be Dr. Kong. So welcome, Dr. Kong.
Thank you so much, Holly. I'm so glad to be here with you.
Yes. So let's just go straight into first. I want people to know, can you give us a definition of what stem cell therapy is? Because we hear about stem cells all the time, right? We hear about this now, everything is a new treatment, stem cell. And you're like, okay, is there some validity to this, or is this all just a phase and a craze now? So, can you just define what stem cells are?
It's definitely not a phase and craze, realizing that we all came from a single stem cell. That's not going anywhere. So, if you just respect the fact that life originated in a stem cell, I mean, we don't want to go back to the far back origin, but something created the cell, right? Something extraordinary that we don't understand. But when your mother and father's the egg meets the sperm, that creates the first stem cell. That's the fertilized egg. And just imagine what might be in that single cell that has the intelligence to know how to divide and how to make multiple copies of itself. And all these copies will further gain functions so they can form different structures, right? Either a ball or a tube, and then they start to form this early fetus. And from that, it develops different organs and eventually becomes you and me. So that is not going anywhere. And it's the power in these cells that we're looking at, because the origin really came from the intelligence. The intelligence is embedded in the DNA. So the DNA is the blueprint. We don't know exactly how it works, but it either tunes in with certain intelligence or it contains some kind of coding that it can interpret the environment and making this life possible. And stem cells go from the very first fertilized egg all the way down to your organs. Let's say your heart. Your heart has heart stem cells. And those heart stem cells can only become a cell of your heart. Whereas if you go from the fertilized egg, it has many gradations. So many variations of itself, but they all are slightly different. So they gain function and they lose potential. So the moment you start to gain more function, then you lose potentials to become different kinds of self.
Mm.
You go narrow instead of wide. So as we go down the evolutionary pathway within this development of a fetus, then all the cells start to go narrower and narrower until you reach the final organ. And that stem cell can only become a cell of that organ. So just imagine you can intercept anywhere along the way in this huge ladder, and you can pick one of those cells. It can give you certain potentials and certain function, right? So nowadays we're focusing a lot on mesenchymal stem cells, and that's not the quintessential stem cell. If you think about the quintessential stem cell, that would be your fertilized egg. But you can also get early stem cells from the early embryo, day 5 to 7. That's where you get the embryonic stem cells. Those are
Mm.
extraordinarily early and full of potentials. But they can go haywire. They can form all kinds of uncontrollable growth, as as a nurse, the teratoma formation. But as you go down further the evolutionary pathway, you start to lose that wild potential. So you get more focused. What we use these days, that's most common, is mesenchymal stem cells, which are everywhere in your body. Anywhere you have vasculature, right, the blood vessels, then you will have these cells hugging the blood vessels. They are waiting for signals from your blood. They're also sensing signals in your neighborhood. So they're
Mm.
kind of like a conduit. So they measure what's going on systemically, and they sense what's going on in the neighborhood. And then they make communication possible. So that's the reason they're called master of regeneration, is because they can mount this response either by telling your body in a systemic way, here, this is what we need, send your white blood cells, and send some macrophages to get rid of the bad cells here, cancer cells, or let's break down some scar tissue. Or they can send signals to the neighborhood once they know what's going on systemically, and tell the neighborhood that this is what you need to do. These are the actions, and they send direct signals, and they have direct communications. They literally have tentacles touching local stem cells. Let's say your heart, you have the heart stem cell. These cells along the blood vessels of the heart, these mesenchymal stem cells, can touch your heart stem cells, literally telling it what to do. So that's why they're the master of regeneration. So when people talk about stem cells, don't think it's one thing. It's this whole ladder of development.
And so that also, I wanted to sort of piggyback, I guess, of what you said. Not piggyback, because I want to sidebar on it, not piggyback, but I want to sidebar on stem cells and how they do have, I guess, the backlash of, is it growing a human or these actual cells? Because I know people are kind of against it whenever they hear about stem cells being grown in a lab, and they're kind of like, well, that's sort of with artificial, I guess, or sort of like in vitro fertilization in the lab, and they're thinking that there's something religiously wrong with growing
Mhm.
it. You get all of these people that are
Yeah,
like
that's just from
anti.
lack of information.
Hmm.
So if you look at the history, the very first stem cell treatment was bone marrow transplant, right? No
Hmm.
babies involved. We simply were transplanting one person's bone marrow to another to help with, let's say, after chemotherapy, right? We replenished the blood supply. And we didn't even know at the time in the 60s that was stem cell transplantation. But now we know we're transplanting stem cells. So that's the origin. And then later on, we realized that, we can get these stem cells from the embryo. And that's when the embryonic stem cells were discovered, and how they were basically destroying an embryo. Because when you obtain these early stem cells, you have to go into this ball, day 5 to 7 after fertilization. You take out some of the cells in the inner cell mass. So that's the cluster of cells. You can take those out, and each one of them can form a full human being. So
Hmm.
that's where the ethical concern comes about, because some will say, okay, this is you're destroying life. Some other cultures may not think that way, but in Christian culture, that is one huge concern, and to the point where in the during George W. Bush, that's when the stem cell uh, stem cell treatments, or no, embryonic stem cells are banned from
Hmm.
receiving federal funding. Is not banned for continued research. Once an embryo is destroyed and the stem cells are obtained, you can keep using that line to do research, but they do not give federal funding for embryonic, uh, more embryonic research that basically involves embryo destruction. but it's still ongoing. The research ongoing, but it's not legal to be used in the U.S. And there's also same thing with fetal stem cells. There are countries that allow that. The most notable is Ukraine. In the US, it's not legal. Same concern. You're destroying a fetus. So that may be where the problem comes about. But
Mhm.
nowadays, what we use as stem cell source, it's have nothing to do with destroying a fetus or an embryo. We are actually either getting stem cells from a person's own body. We can get it from the bone marrow because that's where a lot of stem cells live. And those are full of hematopoietic progenitor cells, which can form a full line of immune cells. And they also contain a little bit of mesenchymal stem cells. And later on, we realized, oh, we can get these cells from the fat because we discovered mesenchymal stem cells, and all these cells, mesenchymal stem cells, are lining the blood vessels that's supplying the fat cells. So then you can get liposuction and get rid of the fat and free the cells from the matrix. And then you get the mesenchymal stem cell, right? There's no
Mhm.
ethical consideration. You're taking cells from your own body and you put it back into your body. And then later on, we discovered there's umbilical cord stem cells
Mhm.
that come from a fully formed and live, healthy birth. So when the baby's born, as we all know, what are you going to do with the cord and placenta? I mean, you toss it in the past, right? There's no use for it in the past. And then they realized it's full of very valuable and very potent stem cells, way more potent than a person's own stem cells because they're so young and so healthy. And they have contained a lot of the early characteristics that was existing in embryonic stem cells, but no longer existing in the adult, fully formed human body. So you're capturing this high potential and also high vibrancy. So that is the third source that's commonly used these days. And that's actually the source I use because it's important to know what may be the most effective for patients,
Mhm.
right? If I'm going to do stem cell therapy, I'm going to give them whatever that's the most effective.
Mhm.
And also, I want to give them the safest. If you look at safety data, very interestingly, your own stem cells may not be the safest for you because your own stem cell, we're looking at this. Yes, it can engraft, which means stay in the body and just keeping living on in the body. That's engraftment. The chance of engraftment is higher because your own cells have your own surface antigens, right? The cell markers, and mark them as, A versus B, right? Jenny versus, James. It Those markers can trigger an immune reaction. So if you use your own, then you don't have that problem. But the problem is your own cells also have lost intelligence. Unfortunately,
Mhm.
it has more toxic buildup. It has gone through your life with you,
Mhm.
and it also has gone through senescence. So when you got older and less potent, and also less ability to sense cancer. So if you put a tumor cell next to it, well, your cells may or may not recognize it's a cancer cell, and it may just tell the cancer cell to grow. That's where the report of cancer promoting properties come along,
Mhm.
because that has been seen. If you put cancer cell next to a mesenchymal stem cells derived from fat, from an adult person's fat, the cancer keeps growing and growing, right? Get bigger and bigger. But if you put an umbilical cord derived mesenchymal stem cell next to the same cancer, both in a petri dish and in live animals' body in a study, these cancer cells, the tumor actually starts shrinking and go away.
Mhm.
So even though they're all stem cells, the younger source have a better ability to detect cancer.
So
So this is why,
even though they're not mine, or you're saying that it's better that they aren't mine, that they're someone else's, because it's.
because they're younger and
Mhm.
more potent. And the issue about engraftment to me is a non-issue because we utilize these stem cells not for their ability to come and stay in your body. We utilize them for their ability to sense signals,
Mhm.
to enlighten your body, to tell everything what to do, tell your immune system, sense signals through your blood and telling the local cells. So they are signaling cells. That's why the inventor or the discoverer of mesenchymal stem cell, Dr. Arnold Kaplan, he was stressing, he was emphasizing, please stop calling these stem cells. These are signaling cells. They're medicinal signaling cells. He kept wanting to change the name, but mesenchymal stem cells, the name is already there. And it's probably going to stay there. Mesenchymal stem cell, they are stem cells. So even though some people would say, oh, you shouldn't call it stem cells, but they are stem cells because you can see them, you can induce them into becoming different cell types, muscle, fat, ligament, and cartilage, bone. But it can even develop into neurons or liver cells when they're really young. When they're older, they've lost certain potentials. But even though they are stem cells, but the vast majority of how they work is not by becoming a local stem cell. It's perfectly capable of telling your own stem cells to, hey, wake up, start making new cells for this tissue that's declining or is injured. So it doesn't need to become your own cells, although once in a while it can. And younger sources will engraft better because they have a more ability to adapt. Just like when you do bone marrow transplantation, you have to have a perfect match. Well, you do as perfect as possible. Even a perfectly matched bone marrow transplant can cause rejection. This is how things are different when you're an adult versus young. But if you use cord blood cells and you transplant to another person completely unmatched, you don't go through any matching process, there's less chance of rejection than the perfectly matched bone marrow stem cells. So that tells you the stem cells from a older person, fully formed, versus stem cells from a very young source like the umbilical cord, which is in between embryonic stem cells and the baby stem cells. When you do transplantation using such a young source, you actually are reducing the chance of rejection. So, but the key is you don't really count on these cells to become your local stem cells. That has been proven over and over and over again, because uh, when they can actually dissect the tissue of animals when they give stem cells to, they want to know, oh, the new tissue that's formed, that must be from the stem cells we just give this animal, because we marked those cells, right? Fluorescent markers. But then they realize, oh, the new tissue are not marked. They did not come from the progeny of these cells we just give, because they all came from a person's own. So that means these cells triggered your body's capability of making fresh new tissue, not by itself becoming the new tissue. So that's a very important distinction.
So I want to thank you for the explanation, because I do know that, again, I hear that especially in the religious sects where everyone is anti stem cell, but I appreciate you breaking it down so that we can all use your beauty line with a clear conscience, because we want to definitely segue into that. So can you tell us? I know you have a cutting edge stem cell skin cream that you use. So for me coming in and I'm like, wow, Dr. Kong, she just really knows what she's talking about. It seems like this is something that I can use. So how did you become someone now that has taken all of this information and created a skincare item?
Um, well, I did not go into stem cells thinking anything about the skin. I just wanted people to recover from all kinds of illnesses and feeling really, effective as a doctor. So once I found stem cells, I started treating patients with all kinds of issues, severe osteoarthritis, chronic pain, lupus, COPD, um, psoriasis, and rheumatoid arthritis, and MS, all these severe conditions that modern medicine doesn't really have a very good solution. They don't have a good solution, right? The only good solution is the knee replacement, which, has its own problems. So I wanted to feel powerful, but I also like health, and I want to look youthful. And I also don't want to put toxins in my body. The moment I knew how toxic all these cosmetics are, I thought, I need to find something that's not going to hurt myself, that I'm doing all these things to be healthy. And then if I keep slathering, on my face and body, things that's going to cause me, hormone disruptions, then I'm really shooting myself in the foot. So let me find something really clean. And just that was not easy because I thought I was buying something all natural, and I, such as expensive Korean products, and they said it's all natural. And then after I use it for a while, I mean, it's fine. There's nothing wrong with it. But then I flip over looking at the bottle and realize, okay, there are all these synthetic ingredients that they weren't really being truthful. And then I thought, okay, now I'm going to go for 100% natural. So I'm going to go to these natural expositions and find something that's fully natural. And unfortunately, I was very disappointed because once I got some samples and left in a drawer for, like a month before I get to it, and they've already separated into different
Mm.
layers. So they are, I didn't think I could trust something that has changed color
Hmm.
and layers, and I don't think I want to put this on my face. And then I realized, okay, I have access to stem cells. I know about the powerful regenerative potential of stem cells. Great for wound healing. I mean, it heals right up, right? So that same kind of potential that can help skin regeneration. And then I understand peptides, and there are all these interesting peptides that can promote skin regeneration. And same thing with herbal extract, with long history of helping skin health, including pore cleansing, including anti-inflammatory actions, even UV protection. So why don't I put all those together to create something that's truly 100% natural? So that's where the Chara Omni cream came about. That is from this quest of finding something that's completely non-toxic and also really potent, that actually works. So like I just got somebody's message today, somebody I barely know, that purchased a stem cell cream, and she said she really works, and she's already seen a huge difference within a few weeks.
Mm.
So, and I hear that a lot. Yeah, so it actually works. So because you will see the difference. I mean, I put on my face, I get nourished all day, right? At night, I put on my face all night long. My skin is supple, so I don't go without it. Yeah, and then that's the only thing I'm willing to put on my face.
So let me ask you this before we go into a discussion about your memoir. I wanted to ask because a lot of women, especially with aging skin, as they get to a certain point, they start to feel like it's too late now to start using something to combat the signs of aging. Like, okay, well, I mean, I have 45-year-old skin now, or I have 55-year-old skin now. It's too late. Nothing can help. Now I have to get a facelift. So, what's your opinion now, being in this skincare industry? Is it too late for women after a certain age to try and come back now and use skincare, or do you see improvement as through the lifespan? What's your opinion about that?
It's never too late to look better, to have a healthy glow, and to reduce the signs of aging, right? It's never too late. But is this a miracle? Is it going to change, erase all your wrinkles? If you have fine wrinkles, yes. But if you have deeper wrinkles, that's going to be very difficult. Yes, though that may take more work. It may take some disruption of the matrix of the wrinkles. So you can't just put a cream expecting the cream and just dissolve all scarring, because that's what deep wrinkles are. The fibrosis. You will have to do something to disrupt the matrix. So you can do microneedling, you can do laser treatments, but you got to disrupt the matrix, and then you can put the cream on, and that will further send you signals to repair and get your cells to be more active. So yeah, so it depends on where you're at. Definitely, but prevention is always the best, the best
Right.
approach.
I just wanted to ask, I was just being nosy. So so my last question is, I want to talk about your memoir because I know you wrote a memoir Tiger of Beijing. So that sounds very interesting. So can you tell us about that?
Yeah, so the memoir is not my full life story. It's only about 3 years of my life that was very dramatic. I was going to write it as a novel. That's how much is of a drama it
Mm,
is. It's from my quest to come to America because I was living in China, hence the title, Tiger of Beijing. Right, I spent my first 20 years of adult life, 20 years in China, in Beijing, and my first visa attempt, which is chapter one, scene one, in the book, was my visa rejection. So I was flatly rejected. And here, as a young Chinese girl, full of ambition and confidence, thinking that I've worked so hard, I got a scholarship to this nice university in Massachusetts. I should, go right over, right? Go to America and have an adventure. And then I was rejected. So that it was a test of character. It was a test. Yes, some people will give up. For me, I just got really angry. I just I it's a, it, I believe that anger comes from life force. It's a life that wants to manifest, wants to express itself. Because I knew there were all these capabilities within myself. There's something greater inside of myself and needed to be expressed. And I did feel um, stifled in some way in China. My personality may not fit as well. I'm very outspoken, very straightforward. I don't do social maneuvering. I did not do social maneuvering very well. I was commented that I'm too naive. Well, they said I'm innocent. That's really, believe me, is not a
mhm,
compliment in China. So I did not feel that I could fully be myself. And I was always breaking rules because I did not like rules that did not make sense. I, I only obey rules that I think make sense. That's for the greater good, that there's a good reason. I don't obey arbitrary rules. So I wanted to come to America because I was stopped and I had no money, no connections, and the reason I was stopped was because I didn't know any person in America that could help me
mm,
to be basically a sponsor. So I decided to just go out and find somebody to know an American. So that came the adventure of just throwing, almost like throwing darts, out and see what will land. And so the universe works in its own magical way, its own mysterious way. I did hear about when I was, back in China, age 20, that when there's a will, then the universe will find a way to make it happen. I said, well, then you find a way. I do have this will. I have this very strong will. So that's what happened. And then I went on this adventure, eventually becoming a tour guide in Tibet. And then I met an American man. And that's, I had this dramatic romance. And then I came to San Francisco. Unfortunately, the relationship was a huge challenge, and there were elements that's very difficult for any person. I don't care if you're a man or a woman.
mm,
If you encounter significant, character defects and narcissism and manipulation, you're going to suffer and be confused. So that's what I went through and how to come out of that because I was trapped. I had no families, I had no support, and I was trapped. So how do you succumb and just live a life of basically bending to somebody else's will and losing yourself in the meantime? Or do you actually seek your destiny, which is to break free? And that's what happened. And
okay,
that
this is interesting.
itself
Okay,
is
so one I got
another,
to read because I want to get all in your
has twists
business,
and
Dr.
turns.
Kong.
So
No,
that
I'm
was the
kidding.
story.
I love that. I love that.
Oh, believe me, it's a fun read. I hold nothing back. So people, the comment is that, very candid.
Mhm.
Yeah, I'm in for being candid, because there's no reason to hide. You're only hiding from the
I love it.
source.
Hey, I
One
always
day it's
say
all going
nothing
to be
motivates you
revealed.
like hurt
So
feelings.
just,
So sometimes you have to
here,
get your
whatever
feelings hurt,
happened
and then
is
all
what
of a
I'm
sudden you're
giving you.
like, oh, that's what we're doing. I'm going to do all of these other things now. I love it. I love it. Okay. All right. So,
I love
for
it. I mean,
anyone, because
that's a way to
obviously we
turn
could
things
talk for
around.
another hour,
That's
but for
wonderful.
anyone
That's
who is
wonderful.
now interested in following you, they're interested in your skin line, they're interested in the memoir, like how can people find you, subscribe, support you, all of that stuff?
Yeah, thank you, Holly. So the best way would just be my website, drjoykong.com, Kong with a K. So it has my clinic information. I provide stem cell therapy at our clinic in Los Angeles. We have people flying in from all around the world and the country to see us. We do some extraordinary um, therapies because I combine different modalities into stem cell therapy, not just counting on the cells, but counting on nourishing the cells, counting on optimizing the terrain of your body to receive the cells. So, and we also have ways to target the cells into different organs. So we do really amazing work. We see patients, as young as 4 years as old as 90 years old. So that's our clinic. And then I also have a stem cell company. That's where the cream comes about. That's, through the company Chara Biologics, and where we actually send stem cell products to doctors all around the country. And the cream is called Chara Omni. So CHARA Omni.com. So people can get cream there. And, but on my website, you will see
Okay,
everything
I
I'm doing,
love it. I
including the
love it. And you
academy I
guys, I will
founded to
also
train
have
other
all of Dr.
physicians,
Kong's
and
information
also
in the
my
podcast
memoir
notes and have
and the cream.
our
Yeah.
clickable links. I always put the website and anything in your social medias, all of that great stuff. So thank you so much. I feel so much smarter, Dr. Kong. I'm like, I'm ready to go. I feel like I can go sit at a table and talk a little bit about stem cells now.
Oh yeah.
Yes.
Please go out and educate. Yeah, people have there's so many misconceptions. We haven't gone through the misconceptions,
Mm-hmm.
but there's so many. Like people think using your own cells are better than using somebody else's, and I just disprove that to you. If you people want to look at my online on YouTube, I have a YouTube channel that people can go on there, Joy Kong MD. I break down the comparisons between using young sources to using your body's own cells. And to me, after going through the studies of what all these, scientists have provided from all around the world, there's really no question what is a superior source. And then, and the misconception that you need a lot of cells to exert benefits. That's why you need to go overseas, because they grow the cells to huge numbers. What we found out is that at a fraction of the number of the cells, but by not manipulating them, by not growing them in a culture, you preserve the original vibrancy and high capacity for regeneration. So when you start to expand them, grow them into huge numbers, they actually decrease in potency. You can give a person
Mm-hmm.
10 times the number when they're expanded cells versus native cells. The 10 times the number can create less benefit. So it's not that you just create the same. You
Okay. All
actually
right.
can decrease
Hey,
potency
I
and
love all
result
the
in less
information.
benefit.
So I'm
So
gonna be
these are some
flying
of the
to
major
LA because I need to
misconceptions.
get some cream and I need to get these wrinkles going here. No.